Imagine a child who has experienced trauma, anxiety, or intense emotions, but struggles to put their feelings into words. A therapist asks them to draw a picture of their family, and suddenly they begin to express emotions they could not verbalize. Another child, who finds traditional talk therapy overwhelming, is given a set of figurines and a sandbox. As they create a story, their inner world unfolds, revealing fears, hopes, and conflicts. These are the transformative moments of play therapy and art therapy, two of the most powerful creative interventions for emotional expression in children. Play therapy is based on the idea that play is a child's natural language. Just as adults talk to process emotions, children use play to express their thoughts and feelings. This approach dates back to the early 20th century, when pioneers like Anna Freud and Virginia Axline recognized that children often communicate symbolically through play. Research has since confirmed that play therapy helps children with trauma, anxiety, depression, ADHD, autism, and behavioral issues. A meta-analysis published in the International Journal of Play Therapy found that play therapy significantly reduces emotional and behavioral difficulties in 75% of cases. One of the most well-known play therapy techniques is non-directive play, where the child leads the session while the therapist observes and interprets. A classic example is a child choosing a doll and repeatedly making it hide under furniture, which might indicate feelings of fear or insecurity. In contrast, directive play therapy involves the therapist guiding the child through structured activities, such as using puppets to act out social interactions or storytelling to process a traumatic event. A powerful case study involves a 6-year-old girl who had witnessed domestic violence. She struggled to express her fear verbally, but in the playroom, she constantly placed a small stuffed animal inside a locked box. Over time, through gentle guidance, she was able to open up about her experiences and develop coping strategies. Similarly, art therapy provides an alternative way for children to express emotions. Unlike play therapy, which focuses on play-based interactions, art therapy allows children to externalize their thoughts through drawing, painting, sculpting, and other creative activities. The American Art Therapy Association reports that over 60% of children receiving art therapy show improved emotional regulation and self-expression. One of the most striking research studies in this field was conducted with children who survived Hurricane Katrina. Many of these children had difficulty speaking about their trauma, but when asked to draw their experiences, common themes of storms, broken homes, and fearful expressions emerged. Art became a safe bridge between their inner world and the outside world, helping them process grief and fear. One particularly effective technique in art therapy is the house tree person test. A child is asked to draw a house, a tree, and a person, and the therapist analyzes elements like size, colors, and placement. A very small house may symbolize insecurity or instability, while a tree with broken branches may indicate trauma or distress. While this is not a diagnostic tool on its own, it offers deep insight into the child's emotions. For children with autism, art therapy can enhance communication and sensory processing. A study at the University of California found that autistic children who participated in structured art activities showed significant improvements in social engagement and emotional expression. Play and art therapy are also particularly effective in grief counseling. When children experience the loss of a loved one, they often lack the words to express their pain. Through activities like memory collages, storytelling, or symbol-based play, they can process their emotions in a non-threatening way. Another fascinating application is sand tray therapy, where children use miniature figures and objects to create symbolic worlds in a sandbox. This technique is widely used with children who have experienced trauma or attachment issues. A notable case involved a child who had been in multiple foster homes. Through sand tray therapy, he repeatedly buried a small figure and dug it up again, symbolizing his unconscious fear of abandonment and his hope for stability. One of the biggest misconceptions about play and art therapy is that it's just about fun activities. In reality, these therapies are structured, evidence-based interventions designed to help children explore, understand, and regulate their emotions. Another misconception is that these therapies are only for young children. While they are most commonly used for ages 3 to 12, research shows that adolescents and even adults benefit from creative therapies, especially in cases of PTSD, depression, and anxiety. With growing recognition of the importance of emotional well-being in childhood, play and art therapy continue to gain popularity. Schools, hospitals, and counseling centers increasingly integrate these approaches, and new digital tools are emerging, such as interactive storytelling apps and virtual art therapy programs. At the heart of these therapies is the belief that every child has a voice, even if they cannot always speak it aloud. By tapping into their natural creativity and imagination, play and art therapy provide a safe space for healing, growth, and self-discovery.